Before we begin, we'd like to thank the Amgen Ireland team for their generous sponsorship and continued support. Introducing Michelle Matthews and Anne-Marie Fay, hosts of the Answers for Cancers podcast. They have a shared mission to empower patients through expert discussions in the field of cancer care. They talk us through their journey in oncology nursing and why they decided to start Answers for Cancers.
Can you give us a brief introduction of yourself and your backgrounds, if you could, please?
Yeah, perfect. I'll kick it off. So my name is Michelle. I am an oncology nurse currently working in the Mater Hospital in Dublin in clinical trials there. I did my postgrad with Anne-Marie last year in UCD in oncology nursing. And yeah, that's kind of my most recent role is in cancer research at the moment, which I'm really enjoying. And then I'm one half of the Answers for Cancers podcast.
Yeah, and I'm Anne-Marie. I'm a nurse as well, and I trained in London initially, and I specialised in intensive care for a few years, and then I moved back home to Ireland and transitioned into oncology then. And yeah, me and Michelle met each other initially. I started on a day wards. That's where we kind of administered the anti-cancer treatments like chemotherapy and targeted therapy and things like that. And then I moved into like a more kind of a CNS position, and then now I'm in breast cancer specifically. So yeah, and then myself and Michelle started the podcast during the pandemic. So yeah, that's pretty much us, who we are.
Cool. Very good.
And what inspired you to go into nursing?
Oh, that's a great question. I suppose, to be honest, mine is a little bit cliche, but I did actually always want to be a nurse. I don't know why, because nobody in my family is a nurse. I think my great granny was a nurse, but other than that, there's no nurses in my family, but it was just something I always wanted to do. So when I was filling out the CAO application, everything was nursing. But to be honest, I wasn't incredibly academic in school. So the points the year before me had gone up by 50 points. So there wasn't a hope that I was going to get in based off the points from the year before. So we were kind of looking at other options over in the UK and things like that. And then lo and behold, they dropped by 60 points the year that I did it. They went straight back up the next year, but it was meant to be. So I got really, really lucky. I got into Trinity College in 2012. 2008. I started training, finished in 2012. So just got incredibly lucky because they've never gone back down since. So yeah,
it's meant to be.
Right.
I'm
that 1 year or so.
Yeah, I never really I never really thought about being a nurse, and I thought I wanted to do teaching. So I went and did that for a little bit. And my granny then actually got really sick, and she was diagnosed like at stage 4. So it was diagnosed quite late, and I left college at that point. And I think it was really her that inspired me, because she just really respected everybody in the hospital. It didn't matter whether you were, you know, the porter or the CEO. She just really admired everybody that was working in a hospital setting. So yeah, I just kind of said, I'll give this a go. And yeah, I just kind of took to it, and it just felt right. So I continued on, and here I am now.
Very good.
So you were a teacher first?
I went to college to do that. So I did about a year and a half, and then I was like, nah, not for me. So yeah, then I kind of felt like I'd kind of messed around for a few years. I was like, God, what am I going to do? So then that's why I moved to London. Then I was like, I'll go over and I'll do it there. And yeah, I never really looked back since. I think it was all meant to happen. I kind of love what I do. So yeah,
it's funny because I can't imagine you as anything other than a nurse.
Smart, yeah.
Yeah,
it worked out in the end.
And I suppose that it kind of shows why you specialize in oncology through your grandmother. But Michelle, was it similar? Was it similar? But what made you fall into oncology?
Yeah, I was actually working in A&E for a couple of years, and to be honest, I kind of knew it wasn't for me. Like I wasn't loving nursing when I was working in A&E. I just didn't have the connection that I thought I was going to have. And one thing that I used to really notice was when I was in A&E, oncology patients would be coming in and out. And one thing that always stuck with me and that I just thought was incredible was that patients would be coming in so unwell, and they would always remember the nurses who were looking after them. So they would always say, oh, will you ring such and such? They know how to get my bloods, or they can access my port, or they'll know my story. And they always did. Every time you'd ring up the ward to ask them, they knew every single patient, they knew every single drug, even if they didn't have their chart in front of them. And I just thought it was really inspiring. I thought it was amazing to think of having that connection with patients. So that's when I kind of thought, I think that would be something that I'd be more interested in. So I was working in Beaumont Hospital at the time, and I did an interview for oncology, and yeah, I went into the oncology unit at Beaumont, which is an incredible oncology facility there. Their inpatient outpatient is phenomenal. So that's where I started my oncology training.
And through your nursing training, both of you, like I suppose you would have had touch points around oncology. Like did you have a period of time through your training doing oncology, or is it different for both?
I did actually. I had my two final placements as a nursing student. One was in intensive care and one was oncology, and I was really torn between the two. But in the UK, I suppose the opportunities in the UK are a little bit broader than they are in Ireland, and it's quite uncommon to get a job in intensive care as a newly qualified nurse. So I was offered that over there, so I thought that I'll always kind of have an opportunity, or I'll be able to kind of go back into oncology, and but I loved both of it. But I just thought starting off ICU would give me a great baseline to kind of start off, and then I could transition into oncology then. But yeah, you did get a really good exposure as a student nurse to kind of jump into the different areas and give you a good insight.
Yeah, mine was slightly different. My oncology part was actually in hematology, so it was when I was in fourth year as well. So for anyone listening that hasn't trained as a nurse, like your fourth year is when you're kind of let off, kind of, I suppose, sort of supernumerary, but you start taking patients and stuff yourself. But my first placement was in a hematology unit, but because they were so sick, they were really neutropenic, they were on incredibly high doses of chemo and going for bone marrows, there was actually very little that we were allowed to do. So a lot of it was just kind of reviewing bloods and reviewing stuff alongside the nurse. So I don't think I really got to properly experience what it would have been like to work in an oncology or hematology department. I thought it was incredible, but to be honest, I was a little bit scared of it because the patients were just so sick and they were really well. And because I finished up there, I think you only do a couple of weeks. Once I finished up there, I never got to see the full picture. I never got to see people recover and that side of it. So I think I didn't get the full exposure to it at the time. But when I was working in A&E, I used to see people come in really, really unwell. And then they'd come back in, or I'd see them walking around the hospital and they looked like a completely different person. So my perception started to change slightly.
Yeah.
And what do you like most about the job, day to day at the moment?
I think the biggest thing that I get from just the job in general is just your exposure that you get just in life in general. Like I think it gives you a really kind of grounded mentality just in life in general, which helps me not sweat the small stuff in my day to day at home, if you know what I mean. It kind of gives you a perception on what's important and in terms of what life is all about, and I think I'm really fortunate to be in situations with people when they're at their most vulnerable, and it's a really privileged place to be. And people really show you who they are, and as a result you get to show them who you really are, and you can just really help people and make a real difference in really difficult moments for patients, and their family members as well, which I just think is such a privilege to do. And I think with like oncology as well and hematology, I suppose it's always changing, so you feel like there's always kind of something new that's coming out, so you do feel like you're kind of learning all the time and you're growing kind of intellectually as well as a person just in general. So I really like that aspect of what we do. It keeps me very grounded, I think.
Very great.
No, I'd agree with that. I think it's the patients that keep you going. Like we were fortunate enough there to have a couple of months where we were able to sort of step away from our nursing roles and focus on a side project. And after the 6 months when we went back, I didn't realize how much you miss that patient interaction until you go back, and it's kind of part of you, and it's funny, like you're seeing patients who you hadn't seen in 6 months, and it's like you're really looking forward to seeing them, and it's just, I think seeing people, as Anne-Marie said, and at their most vulnerable, we're incredibly fortunate to get to be able to be there for people at that. And oftentimes they'll tell you things that they won't be able to tell their own family, and that's a real privilege. Yeah, I think you also like in the healthcare profession, as nurses and doctors as well, you the friends that you make through this profession are
really, really good friends. You know, they really understand what you're going through on any given day, which is hard to understand if you're not in this profession, if you know what I mean. Like, it's hard for your partners and families to really get the day, do you know, that kind of way. So
Yeah.
it's just, yeah, it's great to just have the, like, I feel really lucky. I've made some great friends in nursing, and I just really value them, you know. And I know that's kind of across the board with any nurse I talk to. They've always made really good friendships within the profession, which is also a really plus to the whole job.
Is it in oncology, or just in general in healthcare, I suppose?
Yeah, I think oncology specifically is that definitely stands out for me. Like, I did experience it in intensive care as well. So I do think it does go across the board, but I think oncology specifically, because there is so many ups, but there is an awful lot of downs as well at the same time, you know. You know, there's so many success stories, but we all know there's some stories that maybe aren't as successful as others. And like Michelle said, you know, you really get to know these people, and you feel like you're kind of on the journey a little bit with them as well at the same time. So yeah, you really need your colleagues to kind of rally you up and support you when those kind of things do happen. And then obviously, just, you know, in general, day to day, it's busy old job, you know, so you are pillar to post as well. So yeah, you really rely on your colleagues, because everybody realizes how important we are in the job and how we need to show up for patients. You just need to support each other to enable to do this for a long period of time. You know, you don't want to burn yourself out, so it's important to rely on your colleagues as much as you can.
Very good. Okay, so just moving on, could you just tell us a bit about your podcast, Answer for Cancers?
Yeah, sure. So initially we had an idea for the podcast. This was pre-pandemic. It's weird how you split your life up into like pre and post-pandemic, but pre-pandemic, myself and Anne-Marie, as Anne-Marie mentioned earlier on, we had met in a day oncology unit back in 2019, and we just got on really well, and we had the same kind of ideas. Anne-Marie had come back from the UK, I'd come back from Abu Dhabi, and we could kind of see where we felt that things could be improved. And also there was limited places on the postgrad, so there was a huge amount of us in the same department who all wanted to go and do the postgrad, but there was just limited availability. And we kind of thought, you know, it feels unfair that we're being held back because of either, you know, limited nurses being allowed to do it every year, or limited places. So we had the idea of trying to do a podcast to support nurses initially. That was the idea behind it. So the premise of the podcast was going to be nurse-based, but then the pandemic hit, and we started seeing patients come in who were just so incredibly vulnerable and confused, because with social distancing, they were starting to attend appointments on their own. So they didn't have somebody with them who was listening and taking in the information that they would have before. And I think as we all know, or anybody listening who's been hit with a cancer diagnosis, as soon as you hear the word cancer, you don't hear anything else after that. So what we were seeing was a huge volume of phone calls coming into the oncology unit that we were working in. But also, by the time people were sitting down in the chair to start treatment, they really hadn't a clue what they were actually getting. So that's when the premise kind of changed to be more patient focused. And I'm actually so glad that it did, because we have had such a response from patients through the podcast, and I think actually it's a really valuable resource for people, and I'm really glad that we have changed to do that. And we're very fortunate. We've had a huge amount of consultants come on board. They all volunteer their time, and I mean, particularly in the pandemic as well, when everybody was incredibly busy, but they were all giving up their time after work at night time to come on and record episodes with us, and it's been the same consistently since. So we're very lucky. But the premise of the podcast is just to try and educate people better on their diagnosis and their treatment plan, and some of the more common side effects and less common side effects that can come after cancer treatment, that sometimes we can get missed at the initial sort of, you know, when you're rallying to start treatment and it's kind of go, and all the focus is, you know, starting the chemo or the anti-cancer treatment, and then, you know, actually you can be left with significant side effects afterwards, and we're trying to support people through that as well.
Like Michelle said, like, you know, we it was really highlighted during the pandemic, you know, with people not really absorbing things, you know, not having somebody there, but actually we've realized that actually it's not just because of the pandemic. There's just an overload of information that's provided at the initial diagnosis, which is really, really necessary, you know, and everybody does their best to give the best information and do the best they can. But it's just, it's just really, really difficult to be able to absorb it. And even the family members that are there. So regardless of the pandemic, there's definitely a space for needing something like this that people can absorb in their own time when the stress level comes down a little bit, when they're in their own environment, and something that they can digest a little bit easier than maybe reading hundreds of pages sometimes, or a big booklet on something that's a little bit more, I don't know, sometimes a little bit more difficult to absorb at that time when you're feeling quite stressed.
Yeah, excellent. And what are your plans for the future of it? I know you have another series coming out, is that correct?
Yeah, that's underway at the moment. So we're 3 episodes into that at the moment, and we've a good few planned. So yeah, it's exciting. We had kind of pressed pause for a while because we were focusing on another project. But as soon as you get back behind the mics, obviously it's weird being on the other side of it today, but it's actually great and it's exciting. And it's great having those conversations and putting them out there. So the plan is to definitely continue with the podcast anyway. I think it's
Great. And who are you interviewing? What type of subject matters are you covering in this series?
Yeah, so this series it's a mix match of kind of everything, you know. It's difficult to have it because we're really dependent on people's schedules and our schedules and everything, you know. So it's difficult to get something, you know, a series specific, if you know what I mean. So we just put in episodes kind of as they come and what information we have, and it seems to work quite well because anybody can tune in whenever they want for whatever like interests them, I suppose. But so this season we focused on lymphedema. So we've done a 2-part series on lymphedema, which is a common kind of chronic swelling in the arm for anyone that's listening, that people can get usually after kind of a breast surgery, and there's kind of lymph nodes removed. And I suppose specifically with me working in breast, we kind of see that as it can really, really affect people's quality of life. So we really wanted to put out some good information, and we got some fantastic healthcare workers, a physiotherapist and a lymphedema specialist that came on and did 2 really good episodes on that. We also spoke to one of the psycho-oncologists in the Mater Public Hospital who just spoke about the psycho-oncology service that they provide there. We did a sexual function after a cancer diagnosis episode. God, I'm going blank now. What else have we put out there?
We have coming up with radiotherapy.
Oh yeah.
For breast cancer, genetics for breast cancer. So it's a little bit breast cancer heavy for the first couple of episodes, but that's just specifically because the other project that we've been focusing on, we started with breast cancer. So it just made sense to kind of create a lot of content around that. So it's a bit breast cancer heavy at the minute, but we don't want to obviously forget about all the other cohorts of patients as well. So it's just what we're starting with.
Yeah. We also spoke to a patient as well who shared her story of having metastatic breast cancer at a really young age in her 30s, and she's still undergoing treatment at the moment. So that was a really special episode that we're looking forward to putting out now in the next couple of weeks as well.
Okay,
excellent.
And how, in terms of just globally, are you getting listeners globally, or what's the kind of been the feedback from from people listening?
Yeah, we're looking. So predominantly our audience is in Ireland. When we were tracking it on, Anchor, we can see UK, America, Australia, and Abu Dhabi. I don't know if it's Abu Dhabi. I'm presuming it is because I used to work there, but the UAE in that region. So they tend to be our biggest spots that are listening to us, and there was a couple in Germany as well. But
fantastic!
Our biggest audience is in Ireland.
Yeah.
It's very rewarding to see that, I guess, just to see that, So just the next question, what excites you about the future of oncology, trends or anything like that did you see at the moment?
I think I'm excited for clinical trials. I think I was saying to you before we started recording, I listened to Evelyn's episode last week and I thought it was fantastic. To be honest, before I started working in cancer research, I'm not really sure that I completely grasped how important it was. But it's incredible, and there's so many exciting things happening, and we have so many exciting trials opening up with really positive results. So for me, it's looking at clinical trials and what's coming down the line for patients and what's going to be available for patients in the future. I know Cancer Trials Ireland are working really, really hard to try and get these trials open here, and they're doing a great job at it. We're only one small site, but our recruitment numbers are getting much bigger, and it's exciting seeing patients getting referred from all over the country as well. We have a trial open, or we're referring patients to other sites who have a trial open. So there's definitely more collaboration, I think, between the hospitals. I think we have, do you think we have a long way to go with clinical trials in terms of better educating patients on them? I think, you know, one thing that I find quite difficult is the patient information leaflets that we give patients, and some of the listeners might understand, but I mean, like, I've had one that's 50 pages long that we're given to patients to sign, and it's incredibly hard. So something that I feel really passionately about, and myself and Anne-Marie are working on as part of our side project, is just trying to break all of this down into really easy to understand information. We had a patient information leaflet that was 12 pages long that we managed to put into 3 paragraphs into really simple English. And I think the reality is all patients really want to know when they're approached about a clinical trial is like, what are the other tests that have been done with this drug? Is it going to work for me? If it doesn't, what can I do next? And how is it going to affect my life? And I think that's really what we need to be focusing on when we're talking about clinical trials to patients. And I feel kind of excited because I think there is going to be a bit more of a move towards that.
Yeah. Just wondering about the role of a clinical trial nurse. Are you working with patients day to day who are on trials? And
Yeah. So patients who are currently on trial, and then patients who are on follow-up, and then patients who are looking to recruit to trials as well. So predominantly we'd see patients, either patients who are inpatients who are in clinic, or if we get then refer patients from another hospital as well. So if they're flagged that they're eligible, we'll kind of screen them to make sure that nothing immediately excludes them for the trial, because I suppose the last thing that we want to do is approach a patient about possibly enrolling in a trial if there's something really simple that will exclude them from it. And then we kind of educate the patient on the clinical trial. We'll give them the patient information leaflet and the consent form to go home and consider, and then we get back in touch with them afterwards, after they've had some time to consider it, if it's something that they want to do.
I'd say it's pretty complex because there's always the inclusion criteria.
Yeah, I saw
like
you
50.
guys have it on OncoAssist as well in the
Yeah.
trial section. Yeah. And some of it can be really particular as well, depending on the trial. So like if it's like a really particular stage, or, you know, a type of disease, it can be quite complex. So you always want to be really careful before, you know, approaching or considering a patient that they definitely meet the inclusion criteria as much as possible. I mean, there's always the risk during the screening process that something will exclude a patient as we go along. We just have to set that expectation from the beginning, but as much as possible, we don't want something obvious that we should have flagged prior to meeting the patient to exclude them.
Okay. Yeah.
And it seems like information overload seems to be it seems to be a big issue. I suppose like there's emotions in it. There's a whole lot of factors that attribute to it. But at the end of the day, trying to understand what's in front of them and how they can manage it, it seems to be a massive issue.
Huge. Yeah, it's huge. Absolutely. And I think not that just from a clinical trials, but I think from every aspect of cancer, it's huge.
I mean, it's difficult because the information is necessary and people need to be fully informed. So it's just trying to navigate what's the best format and to give patients this information. And obviously, historically, everything is paper-based, and it's still very heavily paper-based at the moment, that the information is given in that way. And I suppose that's why, you know, we were really happy and excited to be able to provide a different kind of platform that patients could go to in terms of a podcast. You know, maybe listening to something might be able to help them absorb it a little bit more. And so it's trying to get, like I said, trying to find that balance and how can we move forward and progress at the same time while giving them the information they need, but trying not to overload them in any more than we do, giving them an actual diagnosis of something, you know.
Yeah. And I suppose even with the range of treatments out there, it's even more difficult for ye as nurses to kind of understand what to give and what information to give as well. That gives it an extra level of complexity then for ye.
I wonder like what's the best information to give. I suppose we just use different sources, I suppose, of information to give to, like, in terms of actual treatments, like Macmillan is actually really, really good in the UK. And I know it's probably not the best thing to say to give UK based information. You know, we do use the Irish Cancer Society. They have phenomenal information to specific treatments. I know that's not what they do specifically. So when it comes to specific treatments, Macmillan is usually quite a good source, and it's not too jargony, you know, that way. So it's just straight to the point. So that's quite a good source. But yeah, it is, you do need to kind of keep up. And so the drug reps are quite good, actually. They drop in a lot and they give us the most kind of up-to-date information and where to go and what's the best thing to do. So that's quite useful and informative when they do that to keep us updated. But yeah, you do kind of need to be on the ball and make sure you're kind of up to date with what's the best thing to do and give the patients.
Have you, this might be a little bit of a silly question, but have you tried ChatGPT for summarizing like the 5-page documents?
So to be honest, we did try it, but actually I didn't find it that beneficial. I'm sure it is, and definitely I think if it's used correctly, it's probably phenomenal. But some of the stuff I found was incorrect. So like it wasn't summarizing it exactly how it was, or it was like quite American, and it didn't flow right. So I don't know. Now I'm not very techie. Says the two people making an app, but like
yeah,
but yeah, I don't know. I'm sure it's phenomenal if it's used right. What about you?
No, I haven't really, to be honest.
Just out of curiosity, because sometimes if I have a long paper that I need to read, I'll copy and paste some of it in there.
Yeah.
It gives me a summary, but
yeah, I think I'm just not tech inclined. I know that like it's ironic because we're doing techie stuff, but like I'd never think to do that. I'd just struggle through the reading of the 5 pages or whatever it may be, you know. So I probably should make my life a bit easier and use these tools that are available to us now. But yeah, it's interesting, isn't it, all this AI stuff? Yeah.
Is there anything from your side, Michelle, working in breast cancer that you see, you know, any tech or new treatments or anything that kind of excites you about the future?
I suppose that what I like seeing coming in oncology, and I presume hematology as well. I'm not really too au fait with hematology, but you know, like that treatments are just becoming a bit more targeted. You know, there's loads of the trials are becoming much more specific, much more targeted, and I suppose it gives us hope and patients hope that hopefully there'll be less side effects in the future. You know, that we're not, you know, systemically treating the whole body, that hopefully we'll just be able to target areas. And I know that there's some drugs out there that are amazing already, but it's great to see that that's where things are going, and really hopeful for people in the future to be able to, you know, because there's a lot of people living with cancer, and hopefully people will be able to live with cancer a little bit more comfortably with these treatments advancing all the time.
Yeah. So the targeted therapies, you know, I'm trying to, you know, like in breast cancer, do they tend to have less toxicities than something that treats the whole?
Yeah, I suppose it depends on the targeted therapy. It's like everything, you know, so not specifically for breast cancer, I suppose just targeted therapies in general, they're targeting the specific receptor or the specific area in the body. So it's not, you know, like it's not like chemotherapy where it's affecting every single cell in the body, where you have umpteen numbers of side effects that you could potentially get. So and yeah, obviously that's progressing and improving all the time. So hopefully in the future it's there's definitely space for it to get even better, but and I think that's where it's going. So hopefully that's encouraging for patients and family members to know.
Yeah, that's great. So for any patients and caregivers that are listening to this, what tips do you have for navigating cancer care?
So I suppose there's a couple of things. I suppose, you know, for a lot of people, a cancer diagnosis is probably the first time where they've had to stop, and it's about them. So I suppose number one is just to, I know it's hard to be selfish, but just really look after yourself and put yourself first. You know, sometimes you can default to making decisions that make other people happy, but it's one time in your life where you really have to have all of your energy turned inwards to yourself. And I think self-compassion is one of the biggest things and the biggest kind of bit of advice that I would give to anybody. You know, I don't know, I think maybe an Irish mentality could be partly to play in it, but you know, we're all quite hard on ourselves, and there's a lot of questions and blaming of ourselves that I see anyway, and it's it doesn't do any of us any favors, I think, especially when you're going through something like this. So I think having some self-compassion for yourself, which is really difficult when you've never practiced that before, but that's one of the I would say. And then the other thing is that, you know, like there's no question that's too stupid or too simple or too basic. I think some people, you know, wait for ages to ask a question that's really stressing them out. You know, sometimes the things that stress patients and their families out are the, like, you know, the questions about how long will I be there for, or what do you know, like what will that dressing look like, or stuff that they think is too kind of, you know, basic to ask, and it can cause a lot of distress. And I would say ask absolutely every single thing. We understand that this is a new language for anybody that's never been in the hospital before, and there's never any question that's too basic or too simple or that you just should know, because you won't know any of it, you know. So just ask all of your questions, no matter how small they may be, because that's what we're here for. And if we can help in any way to ease the journey, and if you have to ask the questions a million times, that's okay. I suppose they're the two main things that I would say. And I'd also say, you know, it's okay to ask for help and rely on, if you're fortunate enough to have some people around you, you know, family and friends, and really do just rely on them if and ask for some help if needs be. And if that's not the scenario, then you can always contact your healthcare team for some support as well, if that's required. So so they're my main things, I think.
Yeah, no, I think you've summed that up perfectly, Anne-Marie. I think as well, just always being completely honest with how you are really feeling at home with the treatment. I think sometimes people can come in and they can underplay how they're feeling because they're terrified that they won't get treatment, or the dose might be reduced, or something like that. But I think it's just really important to be completely honest with your healthcare team, because as Anne-Marie said, we're here to help and we're here to tweak things that suit the person who is receiving the treatment, and we can't do that if we don't know. So I think the most important thing is just don't be afraid to tell us, and you know, your team will always work with you to get the best solution. And sometimes it can be as simple as just changing medications around. It doesn't mean that you need to change a drug or a treatment, but you know, we can help, and there's amazing stuff out there to help treat some of these horrible side effects that come with treatment, but most of them are treatable once we know about them.
And maybe the other thing is just to avoid Google if you can. I know, like, people automatically default to just wanting to know more, and especially family members that just want to help, and they do is they just armor themselves up with all the information, and that's really valuable in a lot of situations. You know, it is really valuable, and we do say, you know, like, you know, like, knowledge is power and stuff like that as well. You know, it's nice to know what's going on, but I would say just kind of take it with a little pinch of salt, and make sure that you're bouncing these things back in with your doctor or your nurse, just to make sure that you are absorbing the right information, because you know, it's a bit of a minefield sometimes, and everyone's cancer can be so specific to them, you know, so sometimes the generalized information isn't always the best information to be reading. So that's probably one of the other things I'd say.
Okay. And is that fear quite like around how the patient is feeling? Does that happen quite a bit?
Fear?
Fear of just letting physicians and nurses know that they are actually feeling quite bad or something. They're not well. Does that happen quite a bit?
Yeah, I would say it happens regularly enough, you know. People are so naturally, everybody wants to get their treatment and they want to get it done, and they want to get through it, absolutely. And but there can be a little bit of sometimes resistance, because you know, there's we need to if you're feeling like that, we need to wait for we're not going to go ahead with treatment just yet. We need to get you seen by the doctor and this and I think that, like Michelle said, it scares people because they don't want to miss the treatment. They want to get every single dose till the end, you know. And while that's we know that's important, but in some cases that, you know, we've seen that, you know, every single drop isn't always really beneficial either, you know. So but yeah, look, I suppose it's just fear in general, and it's natural, and I think we'd all feel the same, and I think it just comes out in different ways for everybody. You know, it's a really frightening time of anybody's life to go through something like this, no matter how big or small it may be, or how treatable. It doesn't matter how treatable it does matter, because it's important to know that it's treatable, but it's still a horrifically frightening time for anybody to go through. So
because we often hear people say, like, I'm really lucky, I only had to get this, or I only had to get that. But the truth is, like, as Anne-Marie said, it doesn't matter. A cancer diagnosis is a cancer diagnosis. It's huge, and it completely changes your whole life, regardless of what treatment you need. And I think, you summed it up very well when you said just to be really compassionate to yourself, you know.
Yeah. And I think there's still, like, you know, I know definitely, and I think of my parents, like, you know, like, my mom can't even say the word cancer, and I'm working cancer, like, she just said and she'd whisper it and stuff like that, you know. I think there's a huge trauma, like, going back generations upon generations, and you know, if anybody did get cancer years ago, it was never, they seen it as it was never a good outcome. And things are very, very different now. So it's just trying to change. Obviously the fear is natural, but it's trying to just change, like, I suppose just change that like little perception that's there, kind of generational, I think, to let people know that it's okay to be honest about it, and it can be, in a lot of cases it's treated, you know, and it's treated well for a lot of people. So yeah.
So thanks very much for coming on. I really appreciate it, and all the best with your podcast in the coming episodes. Looking forward to listening to it.
Thank you, guys. Thanks a million.
See you on our mics now. They're all
exactly.
Yeah.
We'll be sure as well to link to the podcast in the show notes.
Definitely.
So
Brilliant.
if anyone's
Thank you.
listening, they can download it.
It's great to chat with you. Thank you guys. It's really great.